The nasalis widens the nostrils, and it originates at the maxilla and the bridge of the alar cartilage and inserts at the alar cartilage. The frontalis originates at the galea and the subcutaneous tissue of the eyebrows. It inserts at the skin of the eyebrows and the forehead and blends with the orbicularis oculi, and it elevates the eyebrows. The orbicularis oculi closes the eyes, and it is attached to the lacrimal bone, frontal bone, and maxilla, and blends with fibers at the lateral side of the eye, or orbit. The zygomaticus major is attached to a zygomatic bone, and it elevates the corner of the mouth during a smile, and it blends with the muscles at the angle of the mouth for the insertion. The depressor labii inferioris originates at the mandible body, so the lower jaw, and it inserts and blends with the lower lip muscles, and it depresses the lower lip. The platysma is originating at the fascia of the upper thorax and lower neck, inserts at the mandible in the skin and fascia of the lower face, and it depresses the mouth angle and elevates the neck. The buccinator acts to compress the cheek, and it is attached to the maxilla, and it inserts and blends with the muscles at the angle of the mouth. The pterygoid muscle, medial pterygoid muscle, originates at the sphenoid bone, inserts at the mandible, and it elevates, protracts, and gives your jaw side-to-side capability. The trapezius elevates, depresses, and retracts the scapula, and it is attached to the occipital bone and neutral ligament, and it inserts at the clavicle and the scapula. The external intercostal muscle it originates at the border of ribs 1 to 11 on the inferior border, and on the superior border of the rib below it is where it inserts, and it gives your ribs capability to elevate during inhalation. The pectoralis minor stabilizes the scapula, and it is attached to ribs 3 to 5 and inserts at the coracoid process of the scapula. The external abdominal oblique originates at ribs and costal cartilages 5 to 12, and it inserts at the ilium and linea alba and gives your trunk the ability to rotate. The rectus abdominis originates at the pubis, inserts at the xiphoid process, and gives you the ability to do sit-ups through flexion.